Welcome back to another episode of Rebel Weight Loss and Lifestyle. I'm your host, Cristy, Code Red, author, entrepreneur, retired professional boxer. And in today's podcast, we're going to talk about how to find a healthcare provider. And I think it would be good for this podcast that, Cari, would you introduce yourself and give us a little bit of background? Because I think it's going to be good for our listeners to know, maybe those of you who are new, or just to be reminded that you are an authority in this field. So tell us a little bit about you and your background.
Well, thank you so much. I'm definitely not a healthcare provider myself, but I've seen I played a few on TV. Just teasing. I was on Scrubs. I must be a doctor. No, my name is Cari Thompson, and I do have a background in nursing. I've been did ICU open heart nursing for almost 20 years until Cristy headhunted me. I also taught nursing school. I have a master's in nursing education, and I have worked with, seen myself, and been around my fair share and know a lot of providers. And I do believe that some of our old school ways of thinking of providers has changed. And Cristy and I are going to talk about that today, but I definitely have been in the medical field for a few years. I can tell you the surgeons I like to work with and the surgeons I don't like to work with, but we won't talk about that today. And I think, Cristy, we're probably going to ruffle a few feathers today, add it to our list of podcasts that ruffle feathers, hashtag Cari and Cristy's podcast that ruffle feathers.
Well, I also want to bring up the fact that you had weight loss surgery in Mexico. You were 270 pounds, too small for weight loss surgery in the United States, went down across the border, had weight loss surgery, had massive complications from that, and now have a lifetime of problems because of those complications. You did lose and have kept off over 100 pounds for over 11 years now. And so you have been a patient as well.
Oh, gosh. Yeah. Plus, because of all those complications, I have calcium absorption issues. And so I've had kidney stones. Oh, I'm a mess. Heel spurs. Good Lord. But thank God, thank the Lord for Cristy in the program, which has given me the best version of myself to deal with some of these consequences of my previous actions, you know.
Yeah, we certainly, between Cari and I, we certainly understand a lot of what you're going through. We have, between our coaches, our mentors, the whole Code Red team, we're here to get you through whatever you are going through. And a big question we get on Code Red is, how do I find a healthcare provider who lines up with my way of thinking regarding real food, water, and sleep? And Cari, I'm going to let you start us off here.
So back in the day, Cristy, even as recent as when I was a new nurse, and even depending on where you're living now, and some older people still have this attitude. And the attitude is, number one, that we have to see a doctor, an MD. Some of them even have attitudes about DOs, which is ridiculous. And of course, they don't want to see a mid-level provider. We'll talk about that later. But we see a lot of people that are like, the doctor said. I don't know what this is for, but the doctor said I had to do it. So the old school way of thinking was definitely that you did not question the doctor. They were the ultimate authority. They were not to be questioned. They were not to be challenged. And they told you what to do and you did it. And I don't watch a lot of TV, but I am watching a series called Call the Midwife right now. I'm sure a lot of you have seen it. And it's set back in England a long time ago, around the time of the World Wars. And what's interesting is that even when I'm watching this, the attitude about the physician, definitely it has the same, like they show the physician getting mad and throwing instruments in the OR. That would not be tolerated now. I mean, you can't be doing that. Belittling nurses, talking, that kind of stuff. It should not be taking place anymore. So times have changed. All of that to say is that times have changed. And this is going to ruffle some feathers, Cristy, but here we go. You need to have a doctor who is a partner in your health journey, a partner. They are paid consultants. Now that is going to make some people mad, but they're experts. They're very good at what they do, but you're paying them to help you, not to bark orders at you and demand that you listen. Now, I have a great respect for the healthcare. I have great respect for physicians and PAs and NPs, but they're still partners. And I think a lot of us get caught in these relationships, Cristy, with our primary care providers, that they think they should bark and they should say jump and you say how high. And that is just simply not the case.
Well, I don't even know what to say to jump in here, but I have a little quote card that I've been using to post on social media. And it says, I think it says, in fact, I'm going to pull it up and read it right off to you guys, because I want to get this right. It said, I'm a big believer in the medical establishment for many reasons, but weight loss is not one of them. They are not the end all be all when it comes to weight loss. In fact, most healthcare providers are overweight and metabolically sick themselves. So this is a big red flag for me, sis. When a physician or a provider is trying to tell you about how to lose weight and they're criticizing your journey. They're criticizing the real food, water, and sleep approach. They're criticizing a high fat, low carb diet. They're criticizing what we believe on Code Red. Not even the high fat, low carb. Really, they're criticizing, real food, water, and sleep. You're not going to get behind that. And yet they themselves are overweight and sick.
You may find this interesting, Cristy, but because our nation has become so flippin' woke, okay? Do you realize that physicians and NPs, they don't address weight anymore?
I heard that.
Yeah, they don't talk about it. If you're sitting in that 5 foot, 300 pounds, we don't talk about it because we might offend somebody. There's a scripture I want to read. Because you know, I love my scriptures.
Yes.
Mark 2:17. And when Jesus heard it, he said to them, those who are well have no need of a physician, but those who are sick. And that's why God is saying, I came not to call the righteous, but the sinners. Mm-hmm. And so it is very true that if you are well, you do not need a doctor. However, I'm a firm believer in preventative tests. I believe that people need to be getting their mammograms, their pap smears, their colonoscopies. Guys, don't be stupid. Don't die for something absolutely ridiculous. How ridiculous is that? I hate when people do that. Well, I don't hate it. It's a frustrating thing for me. So your physician is a partner in your partner in crime. You guys are teamed up to receive optimal health. So if you are currently going to a physician that doesn't want to hear how you lost your weight, that poo-poos it, that forces you to get things done that you don't want to do, that does not respect you, that says jump and how high, you're supposed to say how high, it's probably time for a different primary care provider. And the first point I want to make in looking at a primary care provider, Cristy, is that I want you to consider a mid-level practitioner. Now, having a nursing background, my master's degree is not a nurse practitioner, but I will tell you that I have great respect for our nurse practitioners and our physician's assistants that are out there doing primary care. And there are a lot of them that do primary care because we need primary care. And so please know that they can provide excellent care. And if you are super complicated and you have a lot going on, they will get you to a specialist, or they will get you, if they're good, they're going to get you referred out. They'll get help. So you can be well cared for. If you can't see an MD or a DO, you're going to be well cared for by a mid-level practitioner. So that's my first point, is I want to encourage you not to overlook those individuals, because not only do I know a lot of them, but they really do good work. And especially coming from that nursing background, they really care about patients. This is what I have found in my experience in working with mid-level practitioners.
Yeah, they come with that nursing philosophy, as opposed to, or in contrast to physician assistants that come from a more physician philosophy. And the nurse practitioners, I know that one of our coaches, Coach Cari Martin, is an NP, and we just love her to death. In fact, we have, I think, a mentor or two who are also NPs or PAs, and we have loads of respect for them.
Yeah. So 100%, Cristy. So number one, don't overlook having a mid-level. Number two, if you're looking for a new doctor, look around, talk to friends, talk to family. Who do they have that they love? That's what I did when I came here. And I heard about, of course, Brandon retired from the military, and they give you your doctors. So when you get out, you got to find one. So I asked around, Cristy, and I found somebody that everybody seemed to like. He was a mid-level practitioner, and I love him. And so you are absolutely going to do really well speaking with other people and, finding out who everybody likes, because I can tell within the first couple minutes of meeting a physician or a PA or an NP, any kind of PCP, primary care provider, whether or not their personality and my personality is going to jive. And the one we have now is amazing. His name is Todd. He listens to what I have to say. He spends time just visiting with you. And I just was so impressed. I mean, Anne-Marie and Brandon and myself all see him and we love him. And that was word of mouth referral. And I appreciate, it's like a good hairdresser. Army wife, you got to find a new hairdresser when you get somewhere. So I appreciate having that insider information to somebody who is nice and somebody who listens. So that is definitely point number 2, is ask around and find out who everybody loves.
I like that. And we get word here at Code Red all the time of mid-level or MDs also that who support the Code Red lifestyle. And I always send them out a care package. It has sometimes my Code Red Revolution book in it, my cookbook, some 4x6 cards that explain what Code Red is, a handwritten thank you note, because I want to support the people who support the healthy, the proper human diet of real food, water, and sleep. So that's a great one.
My next point, Cristy, is that if you are looking for somebody who may, now I'm not saying that people not in this practice won't agree with Code Red. There are traditional doctors that agree with Code Red all over the place. We should do a database of Code Red doctors, Cristy. Sounds like that would be something fun to undertake here in the new year. But we really do like a functional medicine doctor. And the definition of functional medicine, I'm looking at IFM, Institute for Functional Medicine.org. So IFM.org. It says functional medicine determines how and why illness occurs and restores health by addressing the root cause of the disease for each individual. And I love that approach. So if you'll go to ifm.org and you will click on find a practitioner, you can put in your zip code and they will tell you who is certified as a functional medicine practitioner. Again, they are less a pill for every ill and more, why is this happening? Now, I'm not saying it's going to be, the root cause. I'm not saying it's going to be perfect, but ifm.org is Dr. Mark Hyman's a part of that, Drew Perot. There's a lot of people that really support, and there are other functional medicine doctors that aren't necessarily Institute for Functional Medicine, but that's a good starting point for you. And so that's my next suggestion is, word of mouth. And maybe go to ifm.org and see if you can find somebody. Now, Cristy, somebody may ask, can I see a naturopath? I think it's fine. If you want to go to a naturopathic physician, that's fine. My only concern would be, and this is my personal opinion, is that if you need a GI consult, if you need a colonoscopy, if you need a PAP, if you need to go get to an OB, are they able to get you into those referrals and get you out to those specialists? If you need to see an endocrinologist, I don't know if that is in their scope of practice. So just something to think about, because there are times when your doctor, if they're smart, they're going to refer you out. The best doctors I've ever met say, hey, beyond my scope, I'm going to get you into someone who knows what they're talking about. So I really like that about a good doctor. Same
thing with the chiropractor, right? I mean, people are like they're not going to be able to provide some of the more extensive medicine that you might need.
Yeah. And I have no problem with a naturopathic physician at all. I'm not talking bad about them. Just make sure that you have a way, because you are going to need screenings at certain ages. And you want to be able to get those. And that brings me to my next point is find someone who's up on the research. They all should be. Okay. So I went in, here's a great example. I went in, Cristy, and he's like, family history of colon cancer. And I was like, yeah, my grandma had it. He's like, we need to get you in for a colonoscopy. I'm like, I'm 48. He's like, oh, they changed the age from 50 to 45. I'm so glad that he knew the baseline screening age for a colonoscopy is younger. I could have those numbers wrong. So please don't comment. I could have them wrong, but that was my experience with someone who's up on the research. So find someone who's up on the research, who stays in the journals. which is why I did not want to be a nurse practitioner. I don't want to study that hard. I have a friend named Robin. She's an amazing critical care nurse practitioner in New Mexico. And Cristy, she is always doing research. That girl is always looking at articles, reading the latest. What does the ultrasound show? What does this new antibiotic do? Oh my Lord, so much work. I'm like, just send me the heavy people. I'll help them. Send me the nursing students. I do not want to read articles. And she's really good at that. So you want to find someone who stays up on the research and the recommendations and follows guidelines.
Yeah, I love that. I know that not a lot of them have the time or will make the time. They're just so overloaded, and our healthcare system is so overloaded right now. They barely have the time just to keep up with patient workloads and keep their charting updated. I mean, reading research, I think that a lot of them get the research from the drug reps that come in and try to tell them what this latest paper said. Well, make sure that you are doing your own research.
Well, and part of the expectation as a primary care provider, any kind of provider, is that you keep up. That's kind of just understood.
Oh, I see.
Or you become antiquated. I mean, you have to keep up. And it's a requirement. I mean, these people do a tremendous amount of offline work, a tremendous amount of reading at home. And they have to, Cristy, because evidence-based practice changes and they have to. Like even the years I was out of nursing, Cristy, you would not believe the amount of things, and not big stuff. Like my nursing skills were all still relevant, but to come back in and they're like, oh, we're using lidocaine now in codes. Oh my gosh, we did lidocaine drips back in the day. Like we're back to that. Like and that's how fast medicine changes. And these people, I believe it's just the expectation that they absolutely have to be in the journals and learning. They can go to CEs, conferences, stuff like that, but and let me tell you, it's a burden. Like Cristy said, our healthcare system is overburdened as it is. And then you add that, but it's super important that, like, when I was talking to Todd, he was like, oh yeah, you need one. The age has changed. Wow. Thank you for telling me.
Yeah. Wow.
I wouldn't have known.
How about when maybe a primary care provider that will listen when you present evidence to them of, let's say, cholesterol, instead of just believing the old school evidence?
Thank you. How did you know? Did you read my mind?
I read your help desk knowledge base.
That brings me perfectly to the next one, which is E for ego. And a lot of physicians, a lot of primary care providers, some of this could be born out of concern for the patient, but a lot of this is the ego. I worked with a doctor the other night that had an ego so big, I don't know how they got in the room to go see the patients. I mean, their head was getting stuck on the side, I can't stand it. I can't stand an ego, but a lot of them are so offended and angry when you don't take their advice. It's not about their ego. Now, if they feel like it's dangerous, that's different. And some of that frustration and anger may come from feeling like that you could actually be in harm's way. For instance, cholesterol medication. That's a big hot button for doctors. And some of that could be ego. And some of it could be that they are just like, oh my gosh, I'm legitimately concerned you're going to drop over from a heart attack. Now, there is research but if they give you both sides of an issue and you make an informed choice, they should be like, and so noted, and put it in the chart. Yep. Informed patient of the decisions. Patient chose not to take Lipitor. Patient chose not to get stroke screening. And that way they're covered. I find so many doctors get their ego so wrapped up when people won't listen to them. And it becomes this power play. If your physician, your NP, your PA is power playing with you and gaslighting you and guilting you and being condescending and rude, you are in the wrong office. Listen to me. You are in the wrong office with the wrong person. You should never be made to feel bad. You should never. I mean, it's different if they're like, Cristy, I was so sick. I'm a terrible patient. And the doc's like, I'm going to give you a steroid shot. And I'm like, I don't want steroids. They make me nuts. And she was like, knock it off. And I was like, you're right. Like, I just had to shut my mouth and take the steroids. Like, I needed them. It was a situation where I was very, very sick. I didn't want to get admitted to the hospital. So there are times when you just need to take their advice and just stop. But there are times when they just get so offended and so upset when you don't listen to their angelic, visitations, and that is a frustrating thing for me. So please know that if your doctor leads with his or her ego and you are a strong personality, maybe like myself, maybe like Cristy Code Red, it's going to cause problems. So please find someone that their ego is not wrapped up in this. Now, again, some of you may complain and say, Cari, it's because they care. I do think that is the case sometimes. Sometimes I got to tell you, I've met these people. They don't care. They're just mad because you didn't agree with them.
Yeah. We've had rebels that have not agreed, after 100-pound weight loss, they're like, well, you still need to take, and our rebel was like, no, I'm not doing that. And they refuse to see them anymore. They fired them as patients. Yeah.
Wow.
And I know that I want to say that I've got a great primary doctor. He's a DO. His name is Caleb Redden, and he's out of Boise, and he also works out at my gym. They call him Doc Thor because he strongly resembles Thor, Chris Hemsworth. And he's got a beard. He's just a man's man. I love Caleb Redden. He's great. And he's just jacked. He was on the Titan Games back when that was a reality show. And he practices what he preaches. He lives a healthy lifestyle. He's got a great wife and 3 kids, and everything, his whole lifestyle is around health. And so I can't help but trust him because everything that he preaches, he backs up in his own life. He does the research. He's got no ego. He's so easy to talk to. He's open-minded, but then he's so knowledgeable, and he's constantly doing research, and he's constantly reading the latest stuff that came out, and he gives you both sides. Here are both sides. I've talked to him on the phone a couple of times because he's also overseeing my bodybuilding transformation, and so I have to talk to him quite a bit. I have to stay in touch with him and do blood work and do screening and watch my back and stuff like that. And he's just so easy to talk to. He's so great. And I am so thankful that he's in my life.
When Cristy said, I can't help, when she was talking about Dr. Redden, and she said, I can't help. And then she continued that. What she meant to say was, and I can't help. Okay, he's really cute.
I'm telling you, he would be the guy that I would totally marry.
Yeah. He's got a great wife.
If he didn't have a great wife and already have 3 kids, what would I do? I missed that opportunity somehow.
We'll get in line because I think there'd be a line, Cristy. Cristy Code Red, I think there'd be a line. You'd be at the front.
Yeah, I'd be at the front. I'm going to tell my podcasting guy, Ron, clip this out when you go to edit this. I'm going to send this to Caleb. He'll think that's funny. He'll laugh. Now, listen to me. I'm turning red. Can you guys see me on YouTube? I'm turning red.
I'm getting sweaty too. Woo!
Oh, he's wonderful. I'm so glad I have him.
I follow him on Instagram, Cristy. I'm like, yes, I will fix my knee. Maybe I got an ache now. Maybe I'll come in and see you. My elbow's hurting. Which one? Just a minute. It was definitely my right elbow. How serious would you say your marriage is?
Yeah, right.
Do you guys get along?
Those kids?
Any problems at all? Do you guys have any problems at all? Okay, that's terrible. We're not making disparaging remarks about his wife. She's amazing. He's amazing.
Wonderful.
They love each other.
No,
we're just being funny. So don't be right into the code red help desk. And
yeah,
like they want. Oh, I got to tell you something funny though. We were talking in the room today, and we have a VIP program, and we get special meetings. And I was saying, hey, listen, at the time of this recording, it's almost Christmas. Cheating at Christmas on your eating is like taking your ex back.
Mm-hmm.
I said, after you eat it, you're like, yeah, my stomach's upset. That was not quite as good.
It's 100% greatest example ever.
You're laughing in the room.
Get that on a quote card. We need to get that on a quote card. That was perfect, sis. Oh my gosh.
You do it. You say, well, that probably wasn't worth it. So I'm making myself red.
And that's the truth though, isn't it? My gosh.
Okay. That has nothing to do with the doctor. But all that to say is there are some things that you can do, Rebels, to ensure that you have a great primary care provider. We've given you some great tips. I want you to find someone who is a partner with you. I have a tremendous amount of respect for the medical profession. And I want you to find someone who, yes, they know more. That's what they went to school for. Yes. But they should also respect and be kind to you. Be mindful of their time. Have a list when you go in. Don't just go in there and ramble for 45 minutes. And, you want to absolutely have a list, have a clear, direct purpose. Don't be like, can you look at this wart on my butt? I mean, stop. That's what you're there for, that's fine. So be respectful of them and their time, but also realize if your provider is gaslighting you or making you feel bad about things and not giving you good reason and just, I told you so, there are other providers who would love to take you on as a patient and who would love to expand their practice. So don't be afraid. Don't be afraid to switch if you need to. And I hope we've given you some good tips and tricks on finding a new provider.
Well, this just really helped even remind me of that this is what we need to do as citizens of the United States and the way that our healthcare system goes. This is how we need to handle it moving forward. And so I learned a lot. I hope you guys did too. What a great podcast on how to find a healthcare provider. You guys, we will see you on the next episode of Rebel Weight Loss and Lifestyle. Everyone stay warm because we are recording this in the winter of 2022. And I know it's cold out there. It was 12 degrees this morning. And I know it was here Fahrenheit in Boise. And I know sis, it was pretty cold in Kentucky. I saw you had your stocking cap on when you were feeding chickens. So you guys, we'll see you on the next episode. Thank you again for joining us. Bye, everybody.
Bye.